Okay, but here's the reality, okay? 86% of the trillions and trillions of dollars that we're spending right now, we're spending it for chronic diseases. 6 in 10 adults today have a chronic disease. Pretty soon it's going to be 7 in 10 adults, okay? 4 in 10 adults have 2 or more chronic conditions, right? And pretty soon it's going to be 5 in 10 adults. So those numbers are getting bigger and it's getting worse. 7 in 10, and this is why, remember earlier I said one thing that burns my blood is when somebody, uses the Lord's name, is that the Lord called them home. That just burns my blood. 7 in 10 people who die today die because of chronic diseases. These are not natural death, folks. A 50-year-old man cannot die a natural death. It is not natural. Something inside happened to them. Okay? A natural death is in your old age. Okay? Your body just gave up. But if you died in your 40s, 50s, it is not natural. Maybe you don't know what caused it, but something happened, and it is unnatural. And right now, 7 in 10 death, okay? 7 in 10 people who die unnatural death. These are deaths caused by chronic conditions. So when I hear, that's why when I hear somebody say, well, the Lord called him home, and this, I'm like, no, he didn't. For 70% of these people, the Lord ain't called none of them home. And he has no interest because he needs you here on earth, okay? And that's Bible, by the way. The idea of saying the Lord called them home comes from ignorance. We don't know how to explain why a 40-year-old man died. So we're just going to say the Lord called him home. It's a coping mechanism. That's all it is. And of course, chronic diseases are the leading cause of death and disability in this country. Okay, so again, that's the idea. So what we have right now is we have a disease management model. A disease management model, again, like I explained earlier, is we're going to treat the symptoms, not the root cause. We're going to use drugs and medical procedures and surgeries to address whatever issues you have. We manage disease after it occurs. After it occurs. And the treatment is usually for the rest of your life. Okay? There's no talk about curing or preventing or addressing the root cause. And it views the body as separate parts, each with its own specialist. Remember earlier, I gave the example of the sugar and how excess sugar affects this organ. It leads to this disease. It affects that organ. It leads to that disease. Well, in our healthcare system, you got to go to a different kind of doctor for each of those conditions. Am I right? Right? But it's one root cause. One root cause. That's all it is. And of course, what it doesn't tell you is that medications have side effects. Here's another statistic that's going to shock you. Every year, all right, every year, 250,000 adults die from the use of medications. Yeah, medication-related issues. You see, when you watch the news and then they have a commercial with the drugs, notice they show you the person, he's happy, he's playing a guitar, with his family, he's out there golfing with his buddies, and then what happens at the end when they talk about the side effects? They're rapping, Take Zotofrenax. Talk to your doctor about this, right? You got to slow it down and listen to the nonsense they're telling you. Ladies and gentlemen, if they tell you a medication has side effects, it's going to have side effects. Every medication has side effects. But here's the thing. It might work well for you for the next year or two, right? But by year 3, you go to your doctor and they say, well, you're developing another issue. Do they ever say, well, I wonder if drug 1 can lead to issue 2? No, exactly. They don't talk about that. And you don't think to question it. So now you got another issue. They give you drug 2 for issue 2 caused by drug 1, because every drug has a side effects. And you do that for another couple of years. See, if it happened all at once, people would start questioning things. But because it happens over years, you never question it. You never question. You never put 2 and 2 together, right? It's like if you put a frog in hot water, he jumps out immediately. But if you gradually warm up that water, by the time the water's hot, the frog is fried. He never realized, and that's what's happening here. We don't question. So that's the disease management model.